So I'm delighted that Professor Sir Andy Haines has agreed to speak to us potentially about the impact of climate change on our health, which is clearly a very topical subject, gaining a lot of attention, not only within medicine, but in the general media. Professor Sir Andy Haines is well qualified to speak to us. Although originally a GP who practiced in North London, he has held a number of prestigious posts since and been the Director of Research and Development of NHS Executive for North Thames. He's a consultant epidemiologist at the MRC Epidemiology and Medical Care Unit between 1980 and 1987, and he's worked internationally in a number of different countries throughout the world. Currently, his research focuses on the potential impact of climate change on health, and he's recently chaired the Rockefeller Foundation Lancet Commission on Planetary Health, which is how he's attracted our attention to give this lecture today. So I'd like to welcome Andy to this platform, and we look forward to what you have to say to us. Thank you very much.
Well, thank you very much indeed. Well, thank you very much for inviting me. So what I'm going to do, and it kind of follows quite nicely from the previous lecture about living to 100, actually, because some of the things I'm going to talk about, those of you in the room who live to 100 are going to see some of these, the evolution of the whole climate change threat and witness, I guess, the effects on health. What I'm going to try and do is to give you some background on climate change itself, to say something about how it could affect health, how it's beginning to affect health now, and then to say something about what we need to do, both in terms of adapting to climate change, and we can adapt to some degree, but also to reducing the risks of a dangerous climate change by cutting greenhouse gas emissions. So climate change, in a sense, is just one of a whole range of different changes that are occurring, and since the middle of the last century, we've seen, of course, dramatic improvements in human progress. We've seen an escalation of world population, now over 7 billion people. Growth in economic output, real GDP has dramatically escalated. Urban populations have gone up, so the majority of the world's population now lives in cities. And of course, we've exploited fresh water, so increasingly we've exploited limited freshwater aquifers around the world, and increasing numbers of people are living in countries which are exposed to water shortages. But this progress has also been seen in terms of human health. So since the middle of the last century, life expectancy on a global scale has gone up over 20 years on average, and we've seen marked declines in infant mortality, nearly 3/4, reductions in maternal mortality, and so on. So there's no question that humans have progressed in many ways, but that progress, of course, has come at a cost, and the cost has been borne in many ways by the Earth's systems, and that's shown on the right side of this slide. So you can see that carbon dioxide has taken off. Carbon dioxide is the most important, but not the only greenhouse gas. Nitrous oxide, methane, another important greenhouse gas. Surface temperature has increased, and I'll go through that in just a moment. But also the oceans have become more acidified, so as the carbon dioxide level goes up and that dissolves in the oceans become more acid. And that affects marine ecosystems in ways that we don't yet fully understand. Certainly we do know that it affects the ability of crustaceans, of shellfish, to form their shells, and there's already evidence that the shells of shellfish are thinning. We're also seeing loading of many coastal ecosystems with nitrogen runoff from fertilizers, all part of this quest to grow more food. And of course, we're losing biodiversity at about 100-fold greater probably than pre-human times. So this has led to the use of the term Anthropocene, and I was going to originally use this in my lecture, the Anthropocene epoch, but it's not a term perhaps that's become yet a household term, but I think it is going to be become increasingly common parlance as time goes on. So in the Anthropocene, we're going to see a very different environment on our planet than we have in the Holocene. And remember that humanity really progressed during the last 11,500 years of the Holocene epoch, which was an epoch of relatively stable climate. Obviously, we had fluctuations like the Little Ice Age, for example, but it's a period during which humanity grew from being hunter-gatherers to agriculturalists, and of course to predominantly urban dwellers as we are today. So we're going to face qualitatively and quantitatively different challenges in the Anthropocene to those that we faced in the Holocene. This just shows you changes in surface temperatures since we collecting records since the mid-1800s or so, and this shows you three different records of surface temperatures, which are very, very highly correlated. And they all show random fluctuations, as you'd expect, related to changes in the solar cycle, changes in air pollution, particulates, and so on, but predominantly being driven by the accumulation of greenhouse gases. You can see that increase in temperature, about 1 degree or so, something of that order. So what about the emissions projections? CO2, as I say, is the most important greenhouse gas. And for a time, it seemed like they were plateauing. So there's a couple of years when CO2 emissions seemed to be plateauing, but now they've started to increase again. And it's looked like they increased by about 2.5% or so over 2018. And the global growth, of course, is driven by the underlying changes at the country level. So you see that traditionally, of course, it's been countries like the USA and the EU which have driven greenhouse gas emissions, but increasingly over the last few decades, China has started to take off, become a major emitter, and India, rather belatedly, is also taking off, but obviously at the moment, still on a per capita level, emitting much less than the developed nations. So what you can see is that the numbers are going up, fluctuating somewhat, but still going up. So what is the fate of these anthropogenic or human-induced carbon dioxide emissions? And this slide shows you the sources on the left. Fossil fuels obviously contributing large proportion of the carbon dioxide emissions, but some also from land use, from deforestation as well. And these are the sinks. This is what happens to the CO2. A lot of it ends up in the atmosphere. Nearly 30% ends up in terrestrial ecosystems, forests, and so on. It can stimulate plant growth. And about just less than a quarter ends up in the oceans, where, as I say, it contributes to carbon dioxide fertilization. So the imbalance is about 5% a year, something of that order. So some people say, well, that's a very small amount. How can that cause very much trouble? But of course, over time, these CO2 accumulates in the atmosphere, and that's what's driving, at least in good part, the greenhouse effect. But it's not just carbon dioxide. At the bottom of this slide, you've got carbon dioxide here. That's important because up to 60% of it remains in the atmosphere for nearly 100 years, and up to a quarter, probably around 20%, remains up in the atmosphere for 1,000 years. So that's a legacy that we are leaving future generations from our activities. But these short-lived pollutants are also important. There's black carbon, which is those fine black particles when you are traveling behind one of those old buses or taxis, pumping out that black particulate pollution. A lot of that's black carbon, which is a short-lived pollutant which has health effects, but also when it's deposited on ice and snow, accelerates the melting of the ice and snow. Methane is another important short-lived greenhouse gas, about 12 years in the atmosphere. It comes from gas leakages from ruminants, cattle and sheep, and from rice paddies and other sources. And then there are a few other sources as well, which I won't go into. Hydrofluorocarbons should be limited, hopefully will not be a major problem because they're limited by a relatively new treaty. And ozone is an important pollutant, which is informed in the atmosphere by methane and interacting with other precursor gases. And that's obviously important for its health effects, but also contributes to climate change. So where are we going with the global average surface temperature change? And this slide shows you two essential futures. The top line is a high emission future, which is what might happen if we continue emitting greenhouse gases at historical rates. And that will take us to around 4 degrees average by the end of the century. And then the bottom line is what would happen if we could reduce emissions, cut emissions really quite drastically, as was envisaged initially in the Paris Treaty, the Paris Agreement. Countries agreed to cut their emissions to keep temperature within 2 degrees and, if possible, below that. What's the significance of 2 degrees? Well, the significance of 2 degrees is that's the limit that many climatologists say is necessary in order to reduce the risk of escalating extreme events and escalating risk to human health and human progress. Where are we now after Paris? Well, we're somewhere between these two futures. So if we carry on emitting at the current rates, it would be around 3.2 degrees, something of that order, by the end of the century. So the decisions we make over the next few years, the next decade or so, next few decades, will determine which of these trajectories that we go on. And I'll come back to that at the end. But of course, temperature is not uniform across the planet. The land warms faster than the oceans, and some parts of the planet warm faster than others. And this slide shows you regional temperatures. If the planet was to warm by 1.5 degrees above pre-industrial emissions, then this is what it would look like. In the Arctic areas, we would see an increase of 2 to 3 degrees, something of that order. And as you can see, there's quite a lot of variability in the exposure. We also know that events that occur every 5 years now might occur almost every year under a 2-degree future. So the frequency of extreme heat exposure, for example, will increase quite dramatically. And the IPCC 1.5 degrees that was published just a few months ago showed us how risk could escalate as temperatures increase. And this slide summarizes in diagrammatic form how threats to ecosystems, of extreme weather events, so-called singular events like ice sheet collapse, coral die-off, events or episodes, impacts in the Arctic region, coastal flooding, river flooding, and so on, increase as the temperature rise increases over 1.5 degrees. And you can see, for example, it's going to be very difficult for some ecosystems to keep up with climate change as the temperature increases, because some species can't migrate quickly enough to keep up with increasing temperature. Coral reefs are already showing die-offs. Coastal flooding is already increasing. And in some parts of the world, we're seeing exposure to increasing heat. Human populations can, of course, adapt to some degree. I'll come back to that in a moment, but there may be limits to adaptation. So what might be the implications for human health? And there are a range of different impacts of climate change on human health. Some are very direct, like heat-related illness. Some are less direct, like asthma, cardiovascular disease, vector-borne diseases like changes in distribution of dengue, some types of encephalitis, and so on. Increasing allergens, leading to increased allergy, or changing the distribution of allergy seasons over time, for example. Effects on water quality and availability, undernutrition, and of course these indirect effects, which are more difficult to quantify but may ultimately be very important, like forced migration, civil conflict. As I said, many people now are living in cities, and we know that cities are more likely to suffer from extreme heat exposures than the surrounding rural areas because of the urban heat island effect, which I was illustrated in a sketch of an urban heat island profile in this slide. What you can see is that the urban environment concentrates the heat, so the buildings trap the heat and then irradiate it at night, depending a bit on the surface. So you can paint roofs white, as was done traditionally, and that reduces the extent of the urban heat island to some extent. And you can plant trees, you can have water courses and so on, and that will help to reduce the urban heat island. We know that extreme heat, of course, can have a major effect on health. The most striking example of that was the French heat wave of August, or the European heat wave of August 2003, which caused about 70,000 excess deaths in Europe. And it seems likely that over coming decades, these kind of extreme temperatures will become the norm, as you can see from this slide. The heat wave was extremely interesting from a health point of view. Many of those who died were elderly people, some of them living alone in deprived circumstances, often socially isolated. There was the Chief Medical Officer of France urged the Health Minister to declare a health emergency and recall staff from their holidays. The Health Minister didn't want to do that because it would have created political turmoil, or so he thought, and so he refused to do so. And perhaps exacerbated by that, the death rate escalated and stayed up for a considerable time. This is a heat wave, was very extreme, but also quite long-lasting. We also know that heat has a range of other effects. So it has effects on labour capacity. If you ever tried working out of doors in extremely hot temperatures, you'll know it's extremely difficult to conduct any meaningful physical labour and under extreme temperatures. And the left side of this slide shows you the estimates of the decline in physical labour capacity as a result of increasing heat exposure since the turn of the century. And you can see that globally, physical capacity, labour capacity is already estimated to have reduced by about 5% over the recent couple of decades. And on the right side here, the yellow areas shows you where extreme heat exposure is likely to expand as the planet warms. So at 1.5 degrees, several 100 million people exposed every year to heat levels which will make it extremely difficult to work in the hottest month of the year. And the numbers of people increases as the planet warms. So as it gets above about 2.5, 3 degrees, then perhaps over 1 billion people are exposed to these kind of levels of heat exposure. It's not necessarily a smooth thing. It can go up and down, so areas can go to some extent in and out of exceeding the threshold over time, because there's lots of natural variability as well as climate change. But you can see that large parts of Africa and South Asia become exposed to these very extreme levels of heat, which of course will drive many people back into poverty. But it's not just these direct effects, of course, it's also infectious diseases. Even in areas like Europe, climate change may affect the distribution of a range of infectious diseases. This is a slide of drivers of infectious disease threat events of vector-borne diseases in Europe over a 5-year period. This was some work done by the ECDC, the European Centre on Disease Control, led by Jan Semenza. And their assessment was that quite a range of infectious vector-borne disease threats were triggered to some degree by climate, often interacting with other environmental changes. And many of the others were also affected by land use and other environmental changes. So, for example, the vector for dengue fever, Aedes albopictus, is expanding in Europe, probably partly related to climatic change. There may be also changes in tick vectors, so changes in the distribution of tick-borne encephalitis in Sweden, for example, and maybe the distribution of Lyme disease as well. So a number of diseases may change their distribution. Changes in food safety, for example, salmonella species are thermophilic, so you may get increases in salmonella infections. But probably more concerning, of course, is the effect of climate change on crop yield and crop productivity. And so we believe that climate variability and climate change exacerbates food security in areas currently vulnerable to hunger and undernutrition. So the top slide shows you the estimated impacts of climate change on the productivity of food crops by mid-century. And you can see the red area is where productivity is likely to decline. The green area, it may increase to some degree, but we don't know how long that increase will go on. And we don't know whether populations in these areas subject to declining crop yield will be able to purchase food on the global market. And that's the overlay with the global hunger index. So you can see there's an overlay between those parts of the world experiencing hunger now and those that are likely to suffer from the effects of climate change. This is a slide from colleague Charles Godfrey in Oxford, who looked at the relationship between food prices. These are different measures of food prices, some of them adjusted for purchasing power and some not, but they both show the same trend. And you can see how many cases food riots were related to fluctuations in food prices. So Fluctuations in food prices may also trigger civil unrest, and we saw, for example, the Arab Spring was related by a number of observers to the increase in food prices that occurred when the Russians stopped exporting wheat because of the increased heat in 2010, and that pushed up the price of flour and the price of bread in many Middle Eastern countries. And we can also see that after years of progress on a global scale, hunger is again on the rise, as shown in this slide from the FAO, Food and Agricultural Organization. So it does look as though it bottomed out about 2014 or 2015, something of that order, and then it's starting to creep up again. So the question there is whether climate change, a climate change signal, is increasing the number of people experiencing hunger. And that's something that's at the very active research topic at the moment. But it isn't just staple crops, that's where most of the work's been done. It's also fruit and vegetables. And fruit and vegetables and legumes are important because they are also, of course, an important lack of consumption of them is an important risk factor for non-communicable diseases, heart disease, stroke, some types of cancer. And this is a systematic review done by some members of our team recently, where they've looked at the environmental factors affecting fruit and vegetable production. And this shows you fruit, vegetable and legume yields. You can see that water availability, which is declining in many countries, temperature changes, ozone levels, which are going up in some parts of the world, have a negative effect. Carbon dioxide may stimulate the growth of some crops, but overall the balance is negative. And we also know that when carbon dioxide stimulates the growth of crops, it has effects on nutrition, nutritional content. This is a meta-analysis of the effects of carbon dioxide fertilization on nutrient concentration. So as the carbon dioxide level in the atmosphere increases, then important micronutrients like iron and zinc decline. So although crop growth may be stimulated, as I say, the nutrient quality of the crops may be lower, and the nitrogen level is lower, the carbon level obviously higher. So we also know that climate change will affect precipitation patterns, so drought, for example. And this slide shows you where drought is likely to increase around the Mediterranean, parts of Latin America, southern Africa, parts of Australia and the US. In other parts of the world, precipitation, rainfall, i.e., is likely to increase. So there's going to be an increase in droughts in some regions, increase in intense precipitation in others, and there may in fact be both in some parts of the world. We know that changes in precipitation, environmental change, may affect not just the physical health, but also mental health. And a number of studies have shown that, for example, temperature fluctuations can affect mental health. There's a recent study in the US and Mexico showing how historical temperature changes influence suicide rates. We don't fully understand the mechanism for that. It may be related to reduced crop yield, suicides amongst farmers, but there may be other factors involved as well. And quite a few studies have shown increases in common mental disorders for considerable periods after floods. So if you follow populations after floods for a year or so, you find an elevated level of depression and anxiety. And some work we and colleagues have been doing in Bangladesh have shown that as the sea level rises, you get intrusion of the seawater into the freshwater coastal aquifers, which these populations depend on, and this causes increased salinity in their drinking water. And colleagues in Bangladesh have found an unusually high incidence of preeclampsia in coastal pregnant women and hypertension of pregnancy. And there's a significant association of drinking water with drinking water sodium, and also with non-pregnant adults as well. So you can demonstrate that this changes as the levels fluctuate over the year, and so during the dry season you're getting particularly high levels of salt and high levels of hypertension. There's also some interest and growing evidence about linkages between climate change and some of these complex social changes. So this is a recent paper in Science in late 2017, which looked at the relationship between the applications to the EU for asylum and temperature. And what they suggested was that when the temperature in the growing season of the countries that asylum seekers come from exceeded 20 degrees, there seemed to be a threshold which then caused an increase in the number of asylum seekers. So their hypothesis was that with increased temperatures in the growing season, you get decreased crop yields, and that increased poverty, increased food insecurity, and that fed through into increasing numbers of asylum applications. So many of these are obviously related to economic migration as well as political factors. And they projected forward to suggest that EU asylum applications might increase under climate change depending on the severity of climatic change. So obviously this is a very active area of research. There's still a lot of uncertainties. And another area which is linked to that, of course, is the relationship between climate change and conflict. It's probably not a simple relationship, but climate change may have a role in some circumstances. This is quite a well-known case study of the Syrian conflict, which has been quite widely discussed, quite controversial in its suggestion that the Syrian event, that climate change may have played a role. Is it a causative factor? Well, it may have been a contributory factor. So the drought that accompanied the Syrian conflict, the risk of drought may have been more than doubled by climate change. And when you look at the relationship between the drought and the Syrian conflict, how it caused, drove farmers off the land, increased food prices, increased civil unrest, and then Assad, of course, clamped down with extreme ferocity and exacerbated the internal conflict. So climate change may have played a role in these kind of circumstances. So those are some of the health effects, the direct effects, the indirect effects. To what extent can humanity adapt? Well, obviously humanity can adapt to some degree, and many countries, including our own, have adaptation plans which specifically mention health. So, for example, we can develop heatwave early warning systems which give better warning of heat waves, and the French government, for example, have put in place early warning systems which do seem to have had an effect. They do seem to have reduced the effects of heat in subsequent heat events after the 2003 extreme event. We can also develop early warning systems for vector-borne diseases, for example. So an increasing number of countries do have adaptation plans in place, and some of them do mention health, but there are limits to the extent to which we can adapt. And there are physical limits, low-lying islands, for example. There are behavioural limits according to where people wish to live and why they wish to live there. And then there are technological limits, like, for example, flood defences. So if it were to happen that the Greenland ice caps or the Arctic start to melt, the Greenland ice caps and the Antarctic ice caps start to melt extensively, and there's some evidence that's happening, then these flood defences would need to be uprated, and there would be quite a technological challenge to keep pace with sea level rise. So there's no question that climate change, I think, is posing increasing threats to human health, and there are likely to be limits to which humanity can adapt to those challenges. So the question is, what do we need to do to reduce the risk to humanity, to try to keep us below that 2 degrees threshold, hopefully closer to 1.5 degrees, although that's going to be very, very challenging. So what we and others have been doing is to look at the health benefits arising from a low-carbon economy. One of the challenges of moving to a zero-carbon or low-carbon economy is that change does cost some money. It does affect our infrastructure, it affects our energy supply, it affects to some extent our lifestyles. And so it's proved difficult to motivate decision makers to make the necessary cuts in emissions that are really necessary. And that's why we're going on the wrong trajectory at the moment. So what we've been trying to do is to look at other benefits that might accrue from moving towards a low-carbon economy. And indeed, there are a range of healthcare benefits that will arise from the low-carbon economy, and many of those will be experienced in the relatively near future. So we've looked at policies in a range of sectors illustrated on this slide: clean energy, more sustainable diets, cleaner household energy, active travel, walking and cycling in cities, and so on, and healthcare, which I'll mention at the end. So firstly, what about the benefits of decarbonising the world economy? So this is a slide of a paper that's just come out in the last few weeks, where we've looked at the air pollution benefits from moving towards low carbon energy. The important thing here is that air pollution and climate change is to some extent two sides of the same coin, because many of the sources of air pollution are also the sources of greenhouse gas emissions. So when we burn fossil fuels, for example, we create fine particulate air pollution as well as creating greenhouse gas emissions. So the top part of the slide, it's a thought experiment really. So what's been done here is to use an atmospheric chemistry model which kind of mimics the world economy, if you like. So you can perform thought experiments on this model, this complex mathematical model, to take out different sources of emissions, greenhouse gas emissions. And when you take out all the fossil fuel emissions, you can dramatically reduce air pollution, particularly in India, China, Europe, and parts of the US, which burn a lot of fossil fuels. And that will, on average, we think, result in about 3.5 million less deaths a year, something of that order. If it were possible to remove all of these human-related emissions from agriculture, household energy, and people burning a lot of solid fuel in poor countries and so on, burning land to clear it for agricultural purposes and so on, then we could reduce the death toll even further, perhaps by about 5.5 million, something of that order. In the EU, about perhaps 350,000 premature deaths a year, something of that order. It links quite well with the previous lecture also about longevity, because we also begin to understand that air pollution is a very powerful cause, an important risk factor for non-communicable diseases. So it's responsible for a substantial proportion of heart attacks, stroke, lung cancer, and there's also emerging evidence that it may be a risk factor for cognitive impairment as well. Also, if we tackle some of these short-lived pollutants, we can also reduce air pollution. This is another estimate that's been done showing how we could produce big health benefits by tackling some of the black carbon, methane sources and so on. And the only way really to keep below 2 degrees, that's shown in this slide here, this is the trajectory we're on at the moment, over 3 degrees. If we just cut carbon dioxide, we can get down to about 2.5 degrees. If we just cut the short-lived pollutants, we get down to about 2.5. But if we cut both of them, then we can get down to under 2 degrees warming, which is where we need to be. So we need to cut the emissions of all these climate-active pollutants simultaneously, but won't be easy, but it is technically possible. So we need to do so through clean energy. We need to do so through redesigning our cities. And essentially the future of our health, our planetary health, will depend on cities, because cities are responsible for about 85% of economic activity and about 3/4 of the global energy-related greenhouse gas emissions. So the way in which we design our cities and plan them will be crucial for sustainability in the future. And this slide is a kind of tale of two cities, if you like, illustrates some of the challenges from the way in which we've designed cities in the past. So this is a comparison of Atlanta in Georgia, the USA, with Barcelona in Catalonia. Both house about 5 million population, but Atlanta is a sprawling city. It covers about 7,500 square kilometers. Barcelona is a compact city, about 650 square kilometers. And the transport-related carbon emissions are about 7 tons a person in Atlanta and about 1 ton in Barcelona. The reason for that is fairly obvious. If you live in Atlanta, it's very difficult to do anything except to use your private car to commute. So it's very difficult to commute by walking, cycling, public transport. The mayor of Atlanta is trying to address this, but there are structural issues in terms of these very sprawling cities, which make it more difficult to make it into a sustainable city. So certainly when we come to the developing new cities in sub-Saharan Africa, which will house many new cities over the coming century, then trying to develop compact cities will be an important, both for planetary health, but also probably for human health as well, if we can keep the air pollution levels low. We know that travel policies are crucial for human health and for sustainability. We and others have done quite a lot of work on active travel and low carbon transport, so trying to combine the benefits of reduced air pollution with increased physical activity. This slide just shows you what would happen if the urban population of England and Wales, and I'm sorry, in this particular study we didn't look at Scotland, but I think the implications will be similar in Scotland, if they walked and cycled like the population of Copenhagen. So the population of Copenhagen are very active in walking and cycling, and so we modelled what would happen if we could get the whole urban population of England and Wales mimicking the population of Copenhagen. And this looks at the NHS expenditure averted as a result of reductions in diabetes, dementia, heart disease, stroke, and some types of cancer, possibly depression too. There may be a small increase in road traffic injuries, but we found that the benefits in terms of reduced NCDs would be dramatically outweigh any potential increase in road traffic injuries. Some of those benefits accrue quite quickly, so that quite suddenly after we implement this policy. Others take much longer, like cancer, for example, take a much longer time. But if you quantify this over a 20-year period, then it's about £17 billion, something of that order, costs averted to the NHS. We also know that green spaces have an important implications for human health. I mean, they're beneficial because they reduce the urban heat island effect, but they also seem to have other effects on human health as well. So this is a meta-analysis of effects of green space exposure on mental health, showing you that displeasurable moods seem to be decreased, that's the zero effect line. Pleasurable moods seem to be increased. No direct effect on blood pressure as far as could be ascertained on this particular meta-analysis. So there's a growing body of evidence showing that green space exposure, if you can get access to green space, can improve mental health. And there's also growing evidence about green space and mortality. This is a study in a very large census cohort in Canada, 2.3 million adults, where they looked at the proximity to green space. And they found reduced death rates from cardiovascular and respiratory disease from close proximity to greenness within a few hundred meters of people's domicile. There's some evidence that it's also modified by your educational and income level. So it may also depend on the quality of the green space and how much you use that green space. But there is growing evidence and there's growing interest in the beneficial effects of green space. And of course, a growing number of cities are also have very ambitious plans over coming decades. This is the Mayor of London's draft environment strategy, aiming to be carbon neutral by 2050, zero waste, so it's moving towards a circular economy in which waste is seen, rather than something to be thrown away, is seen as a resource to be mined. I mean, you can get more gold per gram or per kilogram of e-waste than you can from about 13 times as much gold from a kilogram of e-waste than you can from the average mining outfit. So we're wasting a lot of very valuable resources by throwing a lot of it away, as well as creating problems for ourselves. And the Mayor aims to be more climate resilience, 50% green from 47%, better air quality and less noise. And of course, noise also has effects on physical and mental health. So these are ambitious goals. There's a slight problem, I think, with some of these ambitious goals. We've been doing some work talking to decision makers in a range of cities. And they say to us, yes, we're very committed to moving towards a low carbon future. We have ambitious plans. Then you ask, well, what exactly are you planning over the next few years? And what they sometimes say is, well, we're planning to expand our bike hire scheme. We're planning to introduce hybrid buses. And you say, well, that's great, that's all well and good, but that will have a relatively small effect on human health and a relatively small effect on greenhouse gas emissions. So you need to really up your level of ambition. And one of the challenges is, of course, that the Mayor, however much the Mayor wishes to, cannot decarbonise the energy supply of the city because that comes from national grid. And so you have to decarbonise the national grid, which is happening slowly in the UK, but probably not sufficiently quickly. So yes, there's a lot happening at city level, there's a lot of ambition at the level of the city, but we also need national government action. Housing, too, is a potential vehicle for improving health and sustainability. This is a study we did some years ago on the benefits of low-carbon, energy-efficient housing in the UK. And the slide shows you, it's a thermal imaging camera image of an unmodernised house. Here you can see the heat is leaking out through the walls, through the windows, and the modernised house on the right. So it's got modern double glazing, or maybe even triple glazing, I'm not quite sure, but also has had inner wall insulation. And what we estimated was that you could save a lot of deaths, avert a lot of deaths in a country like the UK, and probably reduce greenhouse gas emissions from the housing sector by about half. But there is a catch here, because if you just seal up houses, if you were to seal them up very tightly, yes, you can reduce the energy use in the house, but you will also increase indoor air pollution. So if you've got smokers in the house, if you've got radon, when you cook and release particulates into the air, then that will increase the air pollution. So there are trade-offs. And our conclusion was that if you need to combine insulation with efficient mechanical ventilation and heat recovery, and that's technically possible these days. So one's always got to think about trade-offs. And then moving on to the food system. I haven't said much about the food system, but the food system probably contributes about 30% of greenhouse gas emissions if you include land use change. And of course, is a major driver of NCD risk and so on. We also waste a lot of food. About 30% of the global land is used, agricultural land is used to grow food that is never actually eaten because it's wasted for various reasons. So there's a real need to reduce food waste and to move towards much more sustainable dietary patterns. We know that animal products have the biggest environmental footprint, particularly ruminant meat, of course, has the highest because of the methane involved. And the systematic review we did some years ago showed that even moving towards healthy dietary guidelines would reduce greenhouse gas emissions by 10 to 20%, something of that order, but also reduce land use and water use. Moving to vegetarian diets is obviously culturally more difficult, but has potentially bigger environmental benefits. More recently, the Lancet Commission on healthy diets from sustainable food systems has carried forward some of this work. They've suggested a kind of planetary health diet, which is summarized here, in which they say we should aim to eat 200 grams of fruit a day, 300 grams of vegetables, including 100 grams of dark green vegetables, 100 grams of red and orange vegetables. They also suggest we should eat whole grains as far as possible, small amount of animal source protein, and reduced amounts of beef or lamb. A lot of more nuts and seeds. So they were criticized quite heavily when they published this work by some people who said, well, you're not being culturally sensitive enough. Some countries, of course, the farmers depend on, you're disrupting farming patterns, subsistence farmers and so on, depend on their livestock. So you do need to be culturally sensitive in proposing these dietary changes. But nevertheless, they, I think, performed a very useful service, in as much as they showed that we could reduce mortality, and they suggested over 10 million deaths a year could be averted by 2050, but also improve sustainability. And then finally, let me conclude just by saying a few words about the health system itself. Now, the health system is an important contributor to greenhouse gas emissions. In the US, probably about 10%, something of that order. In the UK, maybe 3%, perhaps a bit more, of greenhouse gas emissions related to the activities of the health system. And the NHS did an activity, funded a study some years ago looking at where the carbon emissions were coming from in the National Health Service. And they showed something a bit surprising, at least a bit surprising to me, because I had assumed that the emissions were all coming from energy-intensive hospitals and so on. And that is true to some extent. So you can see, for example, here, energy use in hospitals is important. The energy embedded in energy-intensive hospital equipment, for example, is important. But one of the things that really stands out here is the embedded energy in pharmaceuticals. So when you create pharmaceuticals, when you synthesize pharmaceuticals, that is very energy intensive. So this suggests that we need to work with pharmaceutical manufacturers to reduce the energy footprint, or the greenhouse gas footprint of pharmaceuticals, as well as reducing the footprint of hospital buildings. So very quickly then, the NHS has got its Sustainable Development Unit, as many of you will know. They are a very tiny group of people, but they have a remarkable impact. They've identified measures which have resulted in nearly £2 billion worth of savings since 2007, an annual saving of approaching 200 million. And of course, the important thing is that if you can save money through energy efficiency, you can keep that money in the local health economy, so it benefits the local health economy. There's only so much you can do through energy efficiency, but it is an important step to take, for example, by having LED light bulbs, more efficient heating, and so on. And there's also evidence that the public wants the NHS to think in a more sustainable way. So this is the result of some of the public opinion surveys, which show that the majority of the public think it's important for the health system to work in a more sustainable way. And a substantial proportion of people think it's important that it should act in a more sustainable way, even if there's a cost involved. And a minority, but a substantial minority of people thought that sustainability should be a top priority. Now, these polls have been repeated over years, and the proportions supporting these kind of actions are gradually increasing over time. And it's a couple of years, I think, since they've done a poll. So you can see that NHS England emissions have reduced by about 11% between 2007 2015, despite an 18% increase in activity. But in order to continue down this trajectory to decarbonise the NHS completely, well, this is an 80%, but we now think it has to be even greater than that, you need to really adopt some quite radical actions. You need to decarbonise the grid. You need to get all the energy from renewable sources. You need to use low carbon vehicles. You need to take care with anesthetic gases that have greenhouse gas properties and so on. And you need to tackle some of the public health issues that I've mentioned earlier. In doing that, we could get to much higher levels of reduction, but there's still a gap between what we need to do and what we can do with current technologies. So there's still some challenges ahead. There's a few brief examples. This is some work that's been done in Nottingham, looking at the provision of food, the hospital food, through using locally provided food to Soil Association standards in the hospital canteen. This is a public investment campaign in the University Hospitals North Midlands, which resulted in about 300k of public investment. So the community owned the solar on the hospital roof, no capital cost to the National Health Service, and the profits that do come from this, from feed-in tariffs and so on, have gone to put towards tackling local food poverty. And this is quite an interesting slide. Some of you may have seen it before. It's Alderhay Hospital in Liverpool, Children's Hospital. So this is the old development here. It's the hospital, it's the car park, big car park. And when they decided to redevelop the hospital, they asked the children, they consulted with the local community, and they asked the children, what kind of hospital do you want? And the children said, well, when we're sick, we want to be able to look out of our windows and see the green. When we're feeling better, we want to be able to go out into the green space and play with our families. Then the hospital planners said, well, we want an energy efficient hospital. So the designers tried to combine all these different requirements. And this is what they come up with. This is a hospital. You can hardly see it, actually. It's got a green roof. You can see that it's designed in a way so that the wards look out onto green space, so that indeed you can look out into these green areas. And they managed by in some way, I don't know how it was done, to actually abolish the hospital car park. I have no idea what kind of arguments they had doing that, but they've successfully essentially got rid of the hospital car park and created this wonderful park around the hospital. So quite a triumph, I think, for sustainable design. So let me end by saying, by reiterating really the need for urgent action, which is kind of summarised in this slide, because the future that we can expect for many of you in the room and for your children, your grandchildren, depends on the decisions that we make in the next couple of decades. And the reason for that is summarised in this slide here. What you can see, I think, is the second ring here, which is the 2-degree ring. you can see that we want to have a 50% of chance of staying within 2 degrees by the end of the century. Then we only have about less than 30 years emissions left at current levels of global greenhouse gas emissions. If we want to keep to 1.5 degrees, a 50% probability, then we have less than 10 years of emissions left at current levels of emissions. So it is really urgent to make these cuts. There's no single answer, of course. There are many policies that need to be put in place. But I think one thing is very clear, that health professionals are going to have a very important voice in all of this. People do still trust and listen to health professionals. And I think that policymakers also are like to listen to what health professionals have to say. So in closing, let me say that I think we are at a difficult stage in human development. The decisions that we make over coming decades will affect the future for our children, our grandchildren, future generations. And we could be looking at a future with very serious adverse effects on human health. But an alternative future also beckons, which is a future depending on low or zero carbon energy, a whole range of other sustainable policies, which could result in a much healthier population around the world, living within the limited planetary boundaries that our small planet affords to sustain perhaps 9-10 billion people by the end of the century. The choice is ours. When I say ours, I mean it's the global population and the political leaders that will make this choice. And I think it's our job as health professionals to try and make the case for the healthy and sustainable choice. Thank you very much indeed.
Thank you very much indeed. So I'll throw that talk open to questions from the floor. If anyone likes to ask a question. Dr. Maguire.
Conor Maguire, I'm a geriatrician here in Edinburgh. When I was a junior doctor, the consultants smoked, doctors smoked, and we were told, you need to stop doing that because it's giving a bad example, and doctors should give an example. Yeah. Should doctors stop driving cars? Should doctors become vegetarian? And should we stop going on holidays to Spain?
So are you trying to get a riot in the room or what? But no, I mean, I think it's a very serious question. I do think that doctors I think we can make the argument that doctors do have a role in leading behaviour change. And we saw this with smoking. I don't say that we should all stop driving. I don't say that we should necessarily stop using any kind of source of greenhouse gas emissions. It's not feasible at the moment to do that. But what I do think is that we should be taking a lead. So where it's feasible to do so, we should reduce our driving. Where it's feasible to do so, we should be using walking, cycling, public transport. And when we need to use a car, we should use a low emission vehicle as far as possible. And that might be a petrol-electric hybrid, it might be increasingly electric vehicle and so on. And increasingly, of course, it's possible for renewable sources of electricity to power those electric vehicles. So we do need to think very carefully, and if you live in a rural area, you'll have different decisions to if you live in an urban area. In an urban area, it's much easier to live without a personal car. In a rural area, it's much more difficult. So we have to be sensitive to people's personal circumstances, but I think it is great if doctors make those changes themselves. I think patients and the wider community will take notice of that. And with regard to diet, again, people are very sensitive about what they eat. They don't like being told what to eat. But again, if people make those choices voluntarily, and people will notice that. And I think we are probably going to see growing trend towards the consumption of reduced animal products and increasing plant-based diets. And I suspect that doctors are going to be leading that charge as they do with smoking. And as hopefully they will do with a whole range of other issues and trends around sustainable living.
Okay, we have a question on the...
Hello. Thank you very much for that excellent overview of the topic. I think we're all quite lucky to have listened to that today. One question, how much does global warming contribute to the heat waves and they say the sudden bursts of flooding that we see in this world? Because I'm not sure that they're directly connected, but maybe there is some.
Yeah, that's a very important question, but the challenge is attributing heat waves to climate change, because heat waves occurred before climate change, so we can't attribute every heat wave to climate change, obviously. So there are now advances in attribution, and our colleagues in climatology are increasingly able to attribute specific events to climate change, or show that it caused an increased probability of that event. So, for example, the Paris heat wave, there's been a fairly recent paper by climatologists showing that heat wave, that the number of deaths that occurred in that heat wave is probably 70% higher than would have happened without climate change. We also know that a range of other things are changing as a result of climate change, and increasingly attribution is being advanced to try and get a quantitative estimate of what proportion of those deaths and health outcomes are related to climate change. So it is an evolving, I would say, a scientific agenda. At the moment, we can't give you an exact number of deaths. Some time ago, the World Health Organization estimated that earlier this century, it was about 150,000 extra deaths that were occurring as a result of climate change. But that was probably an underestimate because it was related to a limited number of outcomes. When we get to these more complex relationships like migration or conflict, where the pathways are indirect, it's really quite difficult to give any kind of quantitative estimates. But again, going back to WHO, the estimates they provided for coming decades are probably 250,000 or so deaths from the pathways where we can easily quantify those. Almost certainly an underestimate. As we look towards the latter part of the century, I think the number's much, much greater, and I think there the bets are off. If we go towards a 4 or 5 degree warming by the end of the century, then that's where we could see really, really serious increases in health outcomes. So it's a long answer to your question, but it's an evolving science. The numbers, we can give some numbers, but they're subject to uncertainties. The important thing is we need to reduce the risk.
Thanks, Ian McCulloch. I'm a retired GP in Edinburgh. You haven't said anything about the possibility of runaway global warming. Is that because you think it's sufficiently unlikely that you don't need to conclude it, and what you've said is bad enough, or for other reasons?
No, it's a very, very important question, and I think one's always got to be a bit cautious about being accused of being too alarmist. So I think, I tend to not to say very much about it unless someone asks me a question, because I think, as far as I understand it, and I'm not a climatologist, obviously I come from a health background, so I have to rely on what my climatologists say. There is a possibility of runaway global warming. It's a low probability, but it's a very high impact if it happens. So the kind of mechanisms that climatologists say could happen is, one is the release of methane from permafrost. So as the permafrost warms, methane is released. Methane is a very powerful greenhouse gas. So you then get into this cycle where increased warming results in increased release of methane. And that's one of the scenarios where runaway global warming could occur. It seems to depend to some extent on whether the permafrost is covered in water or not. So it depends a bit on the precipitation and the amount of water available as well. Another example might be, for example, if the Amazon dieback happens. If the Amazon starts to really crash, it starts to decline very dramatically, and it could do, then we might see, dramatic increase in emissions as a result of that. And also we lose a really important carbon sink, because carbon dioxide is taken up by trees. So if you start to destroy the trees, then you start to destroy your carbon sink. So that could also contribute. And then you get these other things like, not necessarily runaway climate change, but extreme events that could happen, like the collapse of the ice caps, for example, which would increase sea level rise by many meters, depending on how long a timescale you take. And then there's the collapse of the North Atlantic Oscillation, which is this flow of water. So at the moment we get a lot of warming in Europe from the Gulf Stream and so on. If we stop getting that, paradoxically things could get colder. Now, climate scientists say these kind of things are unlikely to happen. One can't rule them out. Why would we want to take the risk? Even if it's 1%, 0.5%, it doesn't make sense to take these kind of risks. We need to, I think, cut emissions very dramatically in order to reduce those risks. So thanks for asking the question. Very important point.
Are there any further questions? Sorry, apologies.
I'm Alistair Thor's, Public Health retired.
I wondered what your view was of the potential for carbon capture as opposed to simply reducing emissions. it's more of an engineering challenge.
Yeah, it is. No, it's a really important point, actually, carbon capture, because you know, given what I've said, you know, we're not doing too well. So, you know, many people, well, increasing number of people are saying we're not going to make it. We're not going to keep things below 2 degrees. So we need to think about radical new technologies. I've always tried to step back from that because I've been a bit concerned that lets people off the hook. You know, if we think there's going to be some miracle technology out there, then that might reduce the appetite for deep cuts. But on the other hand, you've got to, I think, start looking at that now. And you may have seen in the press just a few days ago, Sir David King, the former government chief scientist, has set up a new project to look at carbon capture technologies. So these are technologies which would allow us to suck carbon dioxide out of the atmosphere in a cost-effective way and probably store it underground, either as pump it underground as CO2, store it in old mine shafts, or convert it into solid, carbonates, so that it could be stored in a stable way underground. So there are potential technologies that can do that. They're currently quite expensive. So if you start to strip the CO2 off fossil fuels, for example, then that has a big energy cost and a big financial cost, which is why I think many of these projects have never, like 5 or 10 years ago, we were being told this was going to happen, but these projects were never quite scaled up, because they actually turned out to be quite energy costly and financially costly. So all power to David King. You know, if he can come up with the technical solutions, I think many of us would breathe a sigh of relief. But I think at the moment, that doesn't mean to say that we should let up on putting pressure on governments, including our own, to really cut rapidly. And it was good that our government declared a climate emergency. They now need to match that with action. But we also know that many governments are going the opposite direction. Well, particularly our friends in the US are going the opposite direction. Not the whole of the US. I mean, California is committed to decarbonisation. That's 20% of the US economy. But the US government is sowing seeds of doubt. It's actually contesting the strong scientific evidence. And I think it's an extremely dangerous point in human history because of that. So Mike Pompeo, who's as the Foreign Secretary, as you know, was supposed to go to Greenland to witness the melting of the Greenland ice cap, and he cancelled his visit just a few days ago. He didn't wish to be confronted by reality. So, that's worrying when that happens. I think it will have big political ramifications for the US. That's their lookout, of course, but it will also have big implications for the climate. So we need to support our US colleagues. You know, there's a lot of action now amongst US health professionals. Many of those are taking very strong stands around climate change, so they're doing their best to combat this misinformation. I think we need to support them in their activities.
I think it's that question from the young lady there.
Sorry, I know we're out of time now. I used to work in policy, and I'm studying public health now. And you've kind of spoken a lot about the importance of health professionals influencing government, and that's kind of a new thing that health professionals are working in this space. And I was just wondering if you've observed whether health professionals are taken any more seriously by government and people in leadership than maybe environmentalists and climatologists have been, who've been putting these messages forward for decades now.
Yeah, that's a really important question. I don't have any kind of quantitative data, but I do, well, certainly when you look at public opinion, then we know that the public still values the views of health professionals. I think there's not much doubt in my mind, actually. I think, that's probably borne out by some of the communications research that has been done around communications, that framing it as a health issue rather than an environmental issue is much more likely to get traction. And that may even be amongst people who are sceptical about climate change. I mean, I've certainly been in meetings with people of Republican sympathies, but I've also heard that a number of people who are sceptical about climate change because they've been fed certain information, nevertheless want to enjoy the benefits of clean energy. And they're quite happy to have solar panels, and they're quite happy to move towards zero carbon energy for other reasons. So I think we do need to tailor our arguments to the audience, and I think there's no better profession than the health professions to do that. Whether we can have influence where others have failed, I don't know yet. Time will tell. I do think at the moment there is a window of opportunity to influence the government. And I think what we need to do is to create a kind of storyline which gives politicians positive reasons for moving towards a zero carbon economy. and harnesses the concern that many people have, including I'm sure many people in this room, about the consequences of our current lifestyle, including, for example, levels of air pollution, levels of sedentary lifestyle, and so on. And really, the zero carbon economy can help to address many of these challenges that we're currently struggling with in the NHS, as well as leading to a zero carbon economy.
Okay. I think if there are no more questions, I'd like to thank Professor Sir Andy Haines for what's been a truly excellent lecture that's thought-provoking, unsettling, but truly inspiring. Thank you very much indeed.